Hello, good morning ladies and gentlemen, my dear friend and my honorable lecturer. I am Dewi Puspita Wahyuningtias, number 137. Here I want to deliver my speech with the theme of spinal tuberculosis. Ladies and gentlemen, do you know? Spinal tuberculosis is caused by the same bacteria that causes tuberculosis, namely Mycobacterium tuberculosis. The bacteria can be spread through the saliva that a person with tuberculosis secretes when he sneezes or coughs. This disease usually infects the spine of the lower back of the chest area and the upper back of the waist. Symptoms of spinal tuberculosis. Just like tuberculosis, spinal tuberculosis is also difficult to detect. People with spinal tuberculosis usually experience severe back pain without a known causes. Usually, these symptoms last for 4 months. How to diagnose tuberculosis? If you experience the symptoms of spinal tuberculosis as above, you should immediately visit to a doctor to get a definite diagnosis. The first is through a physical examination. In addition to observing the symptoms you are experiencing, your medical history and family history of illnesses. And the second is through laboratory examination. After the physical examination, laboratory tests will also be carried out to confirm the diagnosis. Various laboratory tests that might be done to diagnose spinal tuberculosis include red blood cell sedimentation test is done to detect inflammation in the body. Montauk skin test to determine whether this person is infected with tuberculosis bacteria or not. MRI and CT scan to determine the level of compression and change in bone element in the early stage of the disease. MRI is recommended of CT scan. Biopsy of bone or synovial tissue to detect the type of bacteria that causes spinal tuberculosis. So, those are the types of tests that can be undergone to diagnose spinal tuberculosis. That is the speech that I can deliver to you. Apologies if there are many mistakes in our words. For your attention, I close with thank you and see you.